so I'll open up the Wenham board. So hi, this is Andrew Ting. I'm the chairperson of the Board of Health for the town of Wenham. And we're having our joint meeting with the town of Hamilton Board of Health. This is August the 12th at 3 p.m. And I am calling the Board of Health in session. And the members of the Wenham Board of Health, if you can just address who you are. We start with Jerry. Jerry, who are you?
Jerry Donovan, member.
And I think, do we have, I didn't see if we have Regina or not.
Regina will not be in attendance today. She is working.
All right, so we have a quorum. Giselle, I guess if you want to, and David or Chris, in David's place, do you want to open up your session?
Sure, I'll sub for David shortly. I'm sure he'll be here. I'm Giselle Perez. I'm opening the meeting from the Hamilton Board of Wealth. Chris?
Yes, and Christopher Small from the Hamilton Board of Health.
Great, thank you guys. So again, the agenda for this meeting is obviously very small that we're looking at today, which is a discussion. And so I think what we were going to do is just have a quick update from the public health nurses for the town of Wenham and the town of Hamilton. Just a very quick update of what's going on with each town, so we just have a basis. Why don't we start with Mary Beth? Are you ready? Mary Beth Ting? No.
Sorry, I was just having trouble unmuting. Thank you all for coming. It'll be a good conversation today. In terms of statistics for the town of Wenham, we have had up to this point, current case count is 21 confirmed cases of COVID-19 and 19 presumed cases of COVID-19. We have 2 individuals about to come off their home isolation. We have no current contacts that I am following. Lots of updates from the DPH, but I think I want to save that for the next Board of Health meeting. The frequent message to everyone needs to continue to be stay safer at home. If you are out and about, please use your face covering. If you're going to be closer than 6 feet, the governor has changed the requirement for face coverings in gatherings, even if they're private gatherings with 10 people or more of different households, that you should have your face covering on. So with that, I'll leave it to Christine Lee, and we'll begin the other discussion after that. Thank you very much.
Thank you, Mary Beth. I just heard that David is on. He was having a little technical difficulty. For Hamilton, college has returned. So our numbers popped up by 2. We have 41 confirmed. Our deaths remain the same. We still have 8 antibody positive, which I love to hear personally. We are currently following 3 cases, whether contact or positive, from the initial number of 41. I do have a bit of a concern. Our Lyme disease cases are climbing, but that's for another conversation. Thank you. I'll turn it over to David Smith.
Hi, everybody. I'm on now. So, yeah. Andrew, tell me, how would you like to this meeting to go? What should be our approach, our content? How shall we manage this meeting?
Yeah. So so just because you just caught up, so we both boards did open session. Giselle opened for you, so you're all set with that.
Thank you.
And then obviously we just had the update from the public health nurses. So again, I think the discussion is regarding that the school committee and the superintendent have asked the boards of health for advice on the best way to both measure what's going on in terms of COVID and its effect on our schools and our communities, as well as guidance on how those metrics would be used as a parts of plans of remaining, whether it be all person with restrictions, a hybrid model, or all remote, which I think recently DESE has put out metrics of the traffic light, which I think is, makes a lot of sense. And I think, David, you and I have done a lot of research, and you've done a yeoman's job of research looking into this, which is very helpful about determining what metrics do we think are important that we can get both reliable data from, that we can track on a regular fashion, whether it be daily, weekly, or bi-weekly, whatever that is. And is those, and then picking, I guess, thresholds that we would recommend to the school committee and superintendent of, you may want to consider changing where you are depending on what's going on. So I think you did a huge amount of work on some of those metrics. If you want to sort of share what I think both boards have reviewed already.
Yeah. I actually was a little surprised to see how simplistic DESE's matrix, the green light, yellow light, red light system looks. It is simply an average per 100,000. I don't know what you want to call it, incidents in the population. I was kind of surprised to express that simply. I propose something a little more sophisticated in that I'm not comfortable with what DESE's proposed as just a single number. I don't like that. So I proposed that we look at it from the standpoint of, yes, what is the incidence in the population, X number per unit of population? What is the percent positivity? What are the number of hospitalizations in our local hospitalizations for COVID-19 in our local hospitals? And that would be Beverly and North Shore. And one other metric would be the let's see how exactly to say this, but something on the order of the incidence of COVID-19 infections in the population of Hamilton Wenham, the population in the surrounding towns, and the population in Essex County. But obviously different metrics for each one. And I think the point of that is, we're not an island. There's going to be a substantial interchange in the schools between the staff and the teachers from into and out of Hamilton and Wenham. So I think we got to recognize that we can't just put up a fence around Hamilton and Wenham and it's impervious. So that was the basis for those metrics that I proposed. This is a struggle. Over what averaging time do you keep track of these? And I think something like 14-day running average is good. It just, you can't go by individual day-to-day numbers. They are just too erratic. So a smoothing function has to be applied to the numbers. But and then a further sophistication is trends. That is, here's the number, yes, but is it trending up or down? And I think that's also an important facet of the metrics to keep in mind. So anyway, that's the gist of what I've proposed and I admit this is a first draft. It is by no means final, and I really feel uncomfortable with no review, comments, critiques on it so far. I think it's got to get scrubbed.
Yeah. So I think what you're trying to point out, I think that, DESE put out a single, like following the incident numbers per 100,000 and then giving thresholds and saying, if you're this or this or that. And then we were looking more of a composite score, right? That entailed whether it's a combination of incidents in a community, we'd have to define that community, which is whether it's just Hamilton Wenham, plus whether you also include Essex County or just surrounding contiguous cities. One of the, one school district in the United States that I looked at also included in part of their composite score the ability for the preparedness within the school of the ability to have, do you have disinfectant cleaners? Can you do whatever is needed to keep the actual physical grounds and stuff prepared, as well as one of the matrices I looked at staffing from faculty and staff, or the number of absenteeism, whether that should be part of the matrix too, and absenteeism, I assume due to COVID or maybe not due to COVID. So there's so many, I guess, things that we could look at. I don't want to make it too complicated, right? We want to pick, I think, metrics that are easily, are objective, that we can obtain easily, and that we can form, whether it's a 14-day average or a 7-day average, that we can then plot and then present. I think, I don't know what the school committee would do, and the superintendent, whether that's something that's posted regularly every day on a website so that parents can know it's a quote green light day or a yellow light day or whatever that may be. So I want to hear from some of the other board members, because I think they've seen the document, and not everyone was able to share some of their comments or opinions. So does other board members want to, or Mary Beth, the public health nurse from Wenham?
David, I really appreciated the plan that you prepared. One question that I have about how easy it is to get the data, I am not sure how we would access Hamilton and Wenham hospitalizations locally or even surrounding towns. I'm not sure how we would get that data for, to put into a matrix. The other things we can absolutely access, the raw numbers of cases in Hamilton and Wenham. Chris Lee and I and the public health nurses working with us can get every day from Maven. We can get the weekly report from the state, the public health report that comes out on Wednesdays will give us information from the contiguous towns as well as the entire state. But that one piece and we also get the percent positivity, because we don't, Chris and I don't get access to the number of people tested until that weekly report comes out. We only get notified of the positive cases that come through. So some of that data we would only have weekly, but the hospitalization piece, I'm not sure how we would access. So I'm a little uncomfortable with considering that as part of the matrix, because I'm not sure how we would get the data.
Well, Mary Beth, I do believe that the daily dashboard report that DPH puts on its website at 4 o'clock in the afternoon does list all of the hospitals in the state. And one of the columns of numbers is number of patients hospitalized with COVID-19. And on the list, there's Beverly Hospital and there's North Shore Medical Center. So both of those, for example, the latest numbers a couple of days ago were a total of 17. I think it was 8 in one hospital.
11, I think, yeah.
Yeah,
I think, David, I think what Mary Beth is pointing out is that we're not talking about necessarily citizens of either the town of Hamilton or Wenham who are hospitalized, as much as the total hospital beds being occupied by COVID patients, and where they originate from could be anywhere in the North Shore, obviously.
That's
so
true.
It's an indirect measure of prevalence of COVID, right? That's why they measure and track hospitalizations and ICU bed and surge, is just as a general overall indirect measure of prevalence of COVID in the community, but it's not going to be specific to Hamilton Wenham. It will just be state. They're just, each hospital has to tell the state at the end of every week how many beds are COVID related. So
exactly, yeah.
So I think, this brings into question our risk tolerance, really, because I think what would be more moving and more informing for me would truly be our transmission rates, how much we have in our community and our surrounding communities, as opposed to the hospitalization rates. I don't want to wait for that. I'd rather just see, what is our rate looking like in our community, and that would lead me to make more of an assumption of what we should do with respect to schools, I'd say, at least for me.
So that would be then, Giselle, that would be like number of new cases per X population of both Hamilton, Wenham?
I would say for both Hamilton, Wenham, but I do think, especially when we're thinking of our teachers and our parents, there's that sort of cross cross-pollination. So we would also need to think about outside of Hamilton Wenham. So certainly what's happening within our community, that's what needs to drive community transmission, but then also thinking about that these are individuals who are coming in and out of our community. So we really need to consider broadly as well as just more specifically.
Yeah, and so then I guess the question is how broad? I mean, obviously data about the county is accessible from the Mass DPH dashboard, but it includes some, at least one town that is on the red zone high impact. So that's going to skew, right, Essex County.
So
But-
that's where I said it depends on our risk tolerance, right? My approach to everything is prevention, not treatment. So I take that stance whenever I'm thinking about sort of public health approach here, and sort of with respect to our schools. I think that once any number we come up with is ultimately going to be arbitrary. It's going to be dependent upon our community. How tolerant, how risky do we want to be? And I think that's the decision that has to be made here with respect to what protocols we have in place so far.
Yeah. I mean, again,
I'd like to point out that if we could really keep in mind, we each have a college facility, and in some of the instances, the colleges will have no impact whatsoever on our K through 12 community. The cases that I recently spoke of causing the uptick in Hamilton, there are no children to these individuals, and they have no connection back to our community. It's a very big piece to look at our college separately from our HW community and who will be intermingling at school.
yeah, but even with that, during an early period of time in each of those individuals, they may have been maybe infectious, but not symptomatic, and going to Crosby's to get groceries or wherever. So we have the same, Wenham has the same thing. It has Gordon College. They have about 1,200 or 1,000 students coming back on. They're going to have some positive cases. I just know it. So that's going to bump up our numbers. But again, if we look at the total size of the community and pick like you said, Giselle, we'd have to arbitrarily pick a number. I mean, right now our rate is like 1.something%.
6.3.
Yeah. So if we have 5 more people, let's say Gordon positive, it won't skew it that much because we can absorb that. But it's one of those things we'll have to determine what that number is. But it does sound like a metric that we need to follow is case positivity rate, and then over time. And as David, I think, eloquently said that a day-to-day is not going to be a true reflection of what's going on. You could get like Chris got 3 in one day, reported in Maven, that's what it showed, but then the next 5 days she's gonna have 0, right? So that averaging it out, and then David, I think that the mass.gov or some other places give you formulas of how to create that 7-day or 14-day average. Mary Beth, you had a question or a comment?
The only difference is where the schools are a potential cluster. And so, it's balancing out the 14-day metric with, if there's 10 in a classroom suddenly, and those 10 could reach out and touch others. So it's balancing out, considering day-to-day versus, say, a 14-day window. And I don't have the magic answer for that, but I think we need to balance those two things. Like maybe there's a certain hit point, if there suddenly becomes a cluster versus the general 14-day average.
Right.
Sure.
Mary Beth, you're absolutely right. The problem with the 14-day average is that it smooths out exactly what you're talking about, which is why we have got to have the intelligence that you and Christine can apply to looking at those COVID output numbers and assessing just that sort of thing. You could have no cases for a week, and then you could have 3 or 4 cases in the next day. And so that the average is going to smooth that out. But that 3 or 4 cases in one day could be highly significant because it might be an incipient cluster. And
Right.
that's where the intelligence has to be brought to bear on those numbers.
And I'd like to advocate for our community to be more proactive. I really think that we can push those numbers and we can sort of wait and see, But the reality is that if you ask our scientists and you ask our researchers, our clinicians, there's an expectation that there will be another outbreak. So even though we have done well in our community, I want to remind everybody that we kind of were proactive back in March and closed everything down quite early. So I think being mindful of those numbers escalating, expecting that they will, and trying to kind of minimize the harm that it can do early on, as opposed to waiting and seeing and then having it be a bigger issue.
Yeah. I mean, again, I think that's why when you look at the DESI suggestion, it's helpful. But again, I think what happens in the community in terms of what's going on with the trends and numbers, and then what happens physically in the school district, have to be taken into bear together. Because again, you could have, oh, the percentage rate in the community is 0.1, but you got 9 cases in the school, right? And if we just use one metric of that, you would say you keep open, you keep on, cohorting the students, take those out or whatever, or vice versa. That the trend is going up slowly, but it hasn't hit the threshold we chose, but the school is 0. It's one of, and I don't want to be in that hard decision seat of a superintendent to make that decision of what should happen. But I think, again, providing, suggesting the metrics in which to follow and some guidance. But again, I don't know if we can, whatever number, you're right, whatever number is chosen is going to be arbitrary, and it may move too, I think, over time as well. It's not going to be static.
It could move. And I think that's sort of, I have several questions for the school committee and for the superintendent in regards to that, because I think whatever plan is put forth, whatever plan is voted on, does need to take into account that there is no magic number. And in terms of the disruptions that it could ultimately cause to our students moving from a hybrid or in-school plan to a remote plan. So I have a couple of questions that I think that I would love the committee to sort of consider from a public health perspective, because I'm not taking a stance here, but rather I do have concerns given the fact that we can't come up with a magic number. We can do our best. So it would be more about what are the things that you're doing, protocols in place to address the concerns.
Great. If I can pop in just for a moment to just outline some of the thinking around this, and then protocols, procedures, ventilation. Tom Gary is well positioned to speak to that. What we are proposing is that there would be a COVID response team made up of members of both boards of health, of our lead school nurse, of the superintendent, the director of facilities, a school committee member, as well as a member from our teachers union. And so at any point, if there appears to be a spike in numbers that needs an immediate response, this team would be called together to look at what is occurring and make a collective decision about the response that needs to occur. I can share with you as superintendent, I do not feel that I have the medical background to be making that call on my own. I know the school committee is highly invested in this, and why we would want a school committee member on that. But having the collective wisdom of a group like that to respond to a significant change in the numbers in whatever way seems like a solution that is worth unpacking here. The other thing that I would offer in terms of the kind of moving back and forth from modalities of learning, we too are very concerned about not having a lot of stops and starts in different modalities. One of the considerations that we have thought about is that the rates at this point in time appear to be lower than they are likely to be later on in the fall and winter. And if we are able to get kids into school, get those personal connections made, get students prepped for the ability to be able to work remotely if that's required, it appears that that would be a more logical sequence than starting remote, coming in for hybrid for a little bit, and then having to go back to remote again. So that's a line of thinking. Again, there is no right answer here, but that's part of our analysis when we start thinking about moving kids back and forth a lot.
Mary Beth, David, you know, I really appreciate hearing what you just said. That makes just perfect sense. And I think the numbers that I'm seeing right now, I think would support and justify that position. That even if you just look at it simplistically from the new red, green, yellow light concept that Desi's put forward, we are in the green light territory. And so it certainly would support doing exactly what you said. But I want to take advantage of your having said that to incorporate another, I think, really vital thought, recommendation, urging, call it what you will. Christine and I are absolutely adamant about the notion that anything that you do indoors is just inherently riskier than anything you do outdoors. And in fact, you know, when you look at the CDC studies on this, something like only 1 or 2% of all outbreaks, clusters, call them what you will, can have been associated with activities outdoors. And that just shows you the advantage that being outdoors offers you in terms of lowering the risk level. So what Christine and I want to emphasize as strongly as we can is that just taking one example, if there's a way to structure lunch breaks so that you have like a grab and go box bag, call it what you will, that each student gets, and then they go outside and maybe they just sit on blankets unless it's raining. Maybe you have to pitch tents, put them under tents. Those are details in Tom Carey's bailiwick, and I'm hoping he would be able to accommodate that. But you know, just getting I mean, if nothing else, getting them outside so they can take their masks off, eat their lunch, and have some semblance of normalcy at that point is I think invaluable. And I just want to encourage you to, and that's a further reason why I like the idea, Mary Beth, of starting in school. You can move kids outdoors in September, October, even November, December. But so the first 3 months, you know, you've got the weather working for you to allow you to go outside, to move a class outside, to take the grab and go lunches and eat outside. I just think that we have to bear in mind how important it is to reducing risk if you're outdoors versus indoors.
And two things I can respond to David regarding your comments. The first is that is our intention with lunch. It will be a grab and go model. And we do have plans to have outside tents set up to have environments where we can get kids out as much as possible. And what I'm hearing from you is, and have seen in previous communication, to be particularly mindful of an outdoor setting regarding lunch where kids would have their masks off.
Yeah.
Tom, do you want to speak a little bit to the preparations for outdoor environments?
Sure, happy to. I have presented at a previous school committee meeting ballpark pricing to provide tents. It would not accommodate the entire student body at the same time. We clearly we do not have the space nor the budget to do so. But in order to provide roughly 5 outdoor learning spaces per school, that's what we're currently seeking to do. And the school committee has tasked us with analyzing the cost between rental and ownership, because renting them for the short period of time in the fall, and with the expectation that we would need them back in the spring. So I am writing the procurement now to analyze both options to be able to do that.
And just
to speak to the, if I can, Madam Superintendent, for the lunches too, is Catherine Donovan is working on a pre-order system to cut down on the amount of traffic in the kitchens. So students would be actually ordering their meals at the beginning of the day to have that grab and go box run a little smoother.
Thank you, Tom. And one of the other pieces that I would add to that is that in almost all of our buildings, in fact, in all of our buildings, the entire school population does not eat lunch at the same time. There are different lunch sessions. So one of the things we can certainly be mindful of in our planning is the extent to which we can try to have lunch outdoor whenever weather permits is something that we can be, like I said, particularly mindful of.
Mary Beth, in one of the emails in the last 24 hours or so, I think it was Michelle, maybe it was someone else, forwarded the ASHRAE committee document on preparing schools and operating schools, the indoor environment for students. And I've read that document. It is daunting. And I'm sure Tom Geary has probably scanned through it. Yeah, Tom, would you agree that what is prescribed is daunting?
Yes, Mr. Smith, it is a tad bit daunting. However, to give both boards of health a little more confidence, we contracted with Environmental Health and Engineering. They're an indoor environmental consulting firm, and they visited each learning space point to point and crafted a report with an executive summary for action items that should take place prior to school opening up. So we received that report, that deficiency list. There's roughly 83 deficiencies to correct to meet the ASHRAE guidance to return our HVAC systems back to their original design intent. Of the 83 deficiencies, 49 of those require immediate action and will impact, like 49 of them are directly related to outside air intake. Many of them can be resolved through controlling programs. So anywhere where we have building automation, some of those items can be checked off the list remotely through computerized programs. Some other ones may take mechanical bypass, but the majority of our learning spaces district-wide actually have the benefit of having isolated ventilation systems. So in modern buildings, you'll see many rooftop units that supply air to many spaces and are controlled by VAV boxes. The fortunate part of having unit ventilators is that we can isolate spaces. So it's individual airflow. So part of the challenge is in fall, September, October, for example, opening up those outside dampers to bring in 100% fresh air. Not that big of a challenge. When we get into the heating season, we're then challenged with bringing in cold air and having to temper that air as it's coming in, not only for occupant comfort, but also for possible infrastructure damage. If we're bringing freezing cold air across a plumbing coil, we're then risking our infrastructure. So finding that balance and using the ASHRAE guidance for outside air percentages as we enter into the heating season will be a challenge. And also areas that have air conditioning, interior spaces, for example, like office and administration areas, we're going to have to balance occupant comfort versus outside air intake. I'll speak to one more point about the ASHRAE guidance. So the ASHRAE guidance suggested that facilities upgrade their filter medium to a MERV 13, and that filters out approximately, I believe it's 0.3 microns. We've already placed the order for a 1-to-1 change out of our filters. We're expecting those in the first week of September. Fortunately, many of our units have already had their PM done on them. So it's as simple as taking the filter that's in there out, putting it back in. So that's one thing that we do have in motion. We will be making the report from EH&E accessible to the public, and not only just the report of the deficiencies, but I've crafted an action matrix to describe the steps that are going to be taken to address all 83 points on the list with expected due dates and actual completion dates. The intent is to be fully transparent on the progress so people can feel assured that each item that's cited on that deficiency list is corrected before we occupy spaces. We'll also, I've added a column into the report too to show room by room which classrooms are affected, so people can track, and we'll make that publicly available so people can see in live time where we stand on those issues.
Tom, that's very impressive, actually. I hope what you've said satisfies the most, if not all, of Michelle's concerns that she expressed about that report's significance for the schools.
Right, and I think, David, that was part of it as we consider looking at what are the matrices that we look at for continuing with whatever model we're going to be starting with or moving into, that the facility and the preparedness, including that, as well as the ability to have hand sanitizer, facial coverings, and the rest should be at least somewhere in that matrix of whatever score we or how we're going to come up with it. So, I mean, again, there's so many, as people can see, there's so many unknowns currently. We do know that there's some things that we can measure. The correct thing, the question is always, are they the right things to measure? And again, we're going to use the best data that we have, which I think right now, a couple of them already mentioned. And so it's probably, and I'll talk to the board, at least both boards, about creating a working group with the school committee to come up with something tangible and final and trackable and presentable, so that we can then have something that the school committee and the superintendent can review, decide if that is something reasonable with our guidance, and that the both towns, in terms of information, can gather and update whatever dashboard we create, so that not only do students know what's going on, parents know what's going on, teachers, faculty, staff, and the community at large have an idea of what's going on with our schools.
So I had a couple of questions though. And I just want to say first and foremost, Mary Beth and to the school committee, I don't envy your position whatsoever. So I do respect how difficult this is for you guys to sort of put this together and take into account or try to come up with a decision that isn't going to please everybody. So I hope you understand that the questions I have are not necessarily to challenge that, but rather from a Board of Health perspective. When I think about what is happening, I'm not only thinking about the physical health of our community, which is, I think, what we're going to arrive at with this matrix, but also the emotional well-being. So I think with respect to when schools are open, so these are the protocols that I'd love to hear more about. You know, one expects that there are going to be disruptions in the classroom, right? So what is going to happen in the events that there is a conflict, student conflict? You know, everything is going to operate in a sort of in a very isolated way. That what's going to happen when students need to be pulled out and then returned? Or how about, what if a child has a cold, right? We don't know. I mean, we know that COVID-19 presents with sort of subthreshold symptoms in kids. And there's obviously, we can't screen because that's actually inappropriate. It could burden the system. But if they have a cold and they're sniffling, what's gonna happen with masks? Or what if they need a hug? The way things stand right now, our teachers shouldn't necessarily be interacting in that capacity with our students. So I understand that part of the movement towards opening the schools, and I can respect, is to support that social emotional component. But I question the school's ability to provide that given this sort of sterilized environment. How are these connections going to be made? Or how about stigmatizing kind of events? So if a child is seen as maybe being sick, we know how much peer connection is important. So how is that going to be addressed? You know, what if students who are in the classroom like, oh, stay away from so-and-so? That can be quite harmful. And other things is, especially with respect to the different plans that are proposed, again, in the event that the schools are forced to close, given whatever arbitrary number we choose, I'm also wondering how that transition is going to take place, because it sounds like the sort of the hybrid plan, the remote component, really relies on the in-person instruction. So once that in-person instruction is removed, it looks like a lot of it will be self-guided. And I just envision sort of spring. And then my last, I don't want to take any more time, but my last question is, again, this peer-to-peer support is so huge in our young population. So what I am concerned about from an equity perspective, and also from just a general self-esteem perspective, what's going to happen a year from now? Because I'm not looking at only September, I'm looking at September next year. So when students are sort of brought back into the classroom together and they're following different curriculum, how are they going to be able to feel comfortable and not continue to compare themselves to their, to their peer who might sort of be in a different level, which we assume is going to happen anyhow, but it's probably going to be more drastic given the different models. So those are my questions. And again, I don't have a specific stance, but I feel like I would love to know more in terms of my my perspective and input from the board.
Yeah, let me see if I can take some of those on, and if I've missed any, Giselle, just let me know, and I'd be happy to go back and revisit them. So I'm going to start with one of the things that you raised is what would happen if we started in hybrid and went remote, or remote the other way. So what we've been asked to do by the Department of Elementary and Secondary Education is to design a model that enables students to shift in and out of these different modalities. And so when we have our teachers back and we are training for 12 days, we are not training for hybrid or training for remote or training for fully in person, but helping teachers understand what components would need to shift if those modalities of learning occurred. So one example I will give you is at the high school. That program is running primarily remote with the design of a 90-minute in-person experience each week per class. So if we started in hybrid, that would shift over, that in-person experience would be replaced by a remote activity that may not necessarily be able to exactly replicate it, but there would be a version of that that would occur for those students. And at the elementary level, we are doing primary academics with teachers, but at the same time, we would be able to move, there's 2 days of instruction, 3 days of remote work. So if we have to shift back and forth, we are substituting those 2 days of in-person instruction into a remote platform. And one of the things I want to assure you and the community is that we heard and understood and agree that the spring did not have the kind of careful planning that we would want to see and deliver the kind of instruction that we believe is possible with the time that we will have to do design. So when we are meeting with teachers and as part of our design team, that is an element that we're very mindful of. So what happens if we have to replace out those 2 in-person days with remote? How do we do that smoothly? So that, I wanted to just let you know that we're thinking that way, because we may say, or the committee may say, you're going to start in remote and something happens, and at the start of the school year, based on metrics, it's hybrid, or there may be a direction to start in hybrid and something happens, and within days you have to switch to remote. So our commitment is to be prepared to move between these modalities. One of the things that, as we had our design team working, we had a number of different priorities, 3 that we became clear, and one was safety, one was the social emotional needs of students, and the third was around what are the instructional strategies that work in these different environments. So the social emotional piece is something that we are incredibly mindful of. I would connect up to David's comment about outdoors, right? To what extent can we bring learning outdoors and have more robust learning environments? We are really trying to stay away from stage on the stage lecturing with kids in rows at 6-foot social distancing. We know that that's not the best instructional models. And how do we do that in an environment that both follows the safety regulations and includes what we would consider best practice in terms of instruction? And we've had a lot of teachers working on this and thinking about this. So one example I would give is if you have had a chance to just kind of flip through the plan document, you'll see a concept that we're looking at the elementary level, where our youngest students would be more on yoga mats with defined spaces and a little scoop chair, so that the environment is appropriate and developmentally sound for those students. Questions like, how do we move students from one area to the building to the next? So what if a student needs to see a counselor? Those are places that we have identified that as needing to be clear in process and protocol, but those answers are evolving and probably will not be evolved all the way until we have our full staff back in. At this point, and then we can come back and see what I missed. I'm sure I missed something, Giselle, but Leah has been doing a lot of thinking as the lead school nurse about how do we address, when does a teacher know that they need to send a student to the nurse, right? How do they send a student to the nurse? What are the different ways if a child looks like they have a cold? So Leah, if I can ask you to respond in some of the thinking that you've done to date.
Hi. To answer your question regarding, what's going to happen if a student is sick, right? So each building, each nurse will have a medical waiting room, okay, in addition to the health office. And if they exhibit any symptoms that could be COVID, they will meet the nurse and be triaged and go into the medical waiting room. We'll have PPE set up outside so that we can assess them and dismiss them, right? If that's necessary. There are some cases that students might have allergies or underlying conditions that might not be COVID, and we'll have that information. We'll talk to their parents and whatnot. So the health offices are going to look a lot different than they did last year, okay? And we're working to kind of identify in each school, where those medical waiting rooms are going to be. And also we have a spreadsheet set up if the students leave, right? How do they return to school, okay? So we're gonna ask the students to, work with the healthcare provider and provide a note. If they have to get tested for COVID, we're gonna ask them for a negative test and to remain outside of school until we have that information. The local Board of Health is going to take care of, contact tracing and, guiding cases. And we're going to help, the school nurses are going to help with contact tracing. So the way that classrooms are going to be set up, we'll be able to give the local Board of Health that information, who would be a direct contact. Because obviously if we have a case and we have direct contacts within a classroom, we're going to have to quarantine those students and the staff within the classroom. So we're going to have to work with the with the local Board of Health to give them that information. So, so documents that we've prepared is returning to school. Also, we have a communication tree set up, and I do have the slides if you'd like me to share them. Mary Beth, what do you think?
I will defer to the committee on that, the Board of Health. Is that something you'd like to see at this time, or would you like us to forward them?
Yeah, why don't you forward them, just because of time. And again, I think, Giselle brings up some good questions of how you are going to operationally deal with students, both from a health, safety, and a educational standpoint. But I think, again, you guys want from us is what's the best way that we can help you measure the activity of what's going on, so that you can make decisions of, as you were talking about, whether you stay as a hybrid or go remote or vice versa. And I think that we do have some metrics that that David has looked at that I think we could refine and then come up with some composite score or whatever it would be to guide you in a decision. Again, any any threshold you put is going to be, tapered with with like what else is going on to make that decision. So
Can
I
I
think
just,
it's,
oh, I'm sorry.
I was going to say, so whether a smaller group of the members of the Board of Health that we can, that David and I can, from each board, whether someone volunteers or we designate that can be then work with you more closely and to come up with those things. And then we, I think that would be best. David?
I agree. I'd like to, if we can, before this meeting ends, agree on the names that we're going to use to form a working group to work with Mary Beth on a product that's usable, that she can comprehend and work with.
Yep. Mary Beth, you had a comment?
Yes, I wanted to say one thing is that we had received from some members of the school committee a list of questions, and Leah Tabenkin and Tom Geary and I began working on answers to those questions. So I'm wondering if, for the sake of time, if it makes sense for us to provide written answers to those questions. And also, we could suggest perhaps that, I don't know who in the school committee or school department would be the person, if there were submitted questions, we could work on an FAQ to pump out, superintendent. And one of my own questions is, in the graphic that came out from the state and from DESE, with the stoplight symbols, next to it there was a DESE expected level of instruction, and that had me a little concerned because according, the proposed plan at the moment is hybrid model for return to school. But when you look at the DESE expectation of instruction, it says full in person, and then it says hybrid with extenuating circumstances. So I was just wondering, is there, where it's an expectation, does that come with any sort of teeth or any sort of negative repercussions? How much independence do we have, and is there any negative pushback from the state if our boards of health and school committee decide to go in a direction that's different than what the color scheme is currently saying?
Thank you, Mary Beth, for that question. That is my understanding that was intended as a model, so that the DESE is not expecting that all districts adopt that. One of the things that they have been clear about is that ultimately this is a local decision. And so while I can advise and recommend to the school committee a plan, it ultimately will be the school committee's decision in terms of whether or not they want to adopt the plan. We have been talking about this question about what modality would we intend to open in, and then how would we shift back and forth. So we're collectively trying to come up with an answer for that. So the stance of the DESE at this moment is that ultimately this is a local control decision. And again, the ultimate approval of this plan does rest with the school committee. And Michelle, I wonder if you want to make any comments related to that?
As far as how do we move forward?
Just in terms of, I know that the meeting is scheduled for Friday for the committee to look at the plan again. We had had a discussion about who might be on that team, and I think,
Right.
David, what you were asking for, what are names? Michelle, I understand that you've identified somebody from the school committee.
Well, so Mary Beth would like to form a COVID response team that would advise her on what we would do. And she has proposed those names. So I did call a couple of people on the school committee. There are 2 people who are willing to do it. Mary Beth can ultimately decide who that is. But because it's a team that would need to respond rapidly, like Mary Beth might get a call at 10 that says, hey, we have someone who we think we're sending home who we think is going to be COVID positive, or we got a note from a parent today. And then these people would need to meet, like pretty quickly to decide what was going to happen next. Because this needs to be quick and nimble, we want that to be Mary Beth's position to appoint that advisory committee to be advisory to her. That way it is not a public body. If the school committee or the boards of health designate who that person is, it will then become a public body and it won't be able to meet until 48 hours, or you'll always have to be posting these emergency meetings. So, to me, so far, the plan that Mary Beth has put out is that we have a COVID response team that will advise Mary Beth on what the matrix should be of these health things, and then maybe the Board of Health can approve it, and then the school committee can approve it. That way we don't have this like debate later on, unless scientific evidence comes forward that would change our matrix. And then of course that COVID response team could make adjustments. But you know, our goal here is to find ways that we don't have to debate the issues over and over again, because we believe that the smoothness that people are talking about is important, that we can try and stay where we are, but when we see trends, we can try and plan if we need to change. So,
yeah. No, I mean, that makes sense if you want to if you want to be nimble and pivot very quickly. And again, for us, you know, an advisory committee, obviously for me, I'm gonna, David, you'll probably not like it, but I would suggest that the public health nurses be, since they are not boards members per se, but they know what's going on a day-to-day basis and know what's going on with the boards, they would have the best ability to inform you and guide you about things. So from my standpoint, again, I'm saying that for them, but I know they have a lot of things on their plates now. But that's who I would recommend, just to make it easier from that point of view. So
Andrew, I endorse 100% what you just said.
Yeah. So I don't know if that, and then of course I'm missing my rules of Roberts, Jackie, to tell me if I need to make a motion for that. Do you know?
Please do not make a motion, because if you make a motion and vote, it becomes a public body, and then that public body has to post 48 hours or continuously post emergency meetings.
All right.
So if you allow Mary Beth to make an advisory group that can advise you and can advise us,
right,
it will run much smoother.
Right.
So it's sort of this, we've been talking a lot about this sort of like trust. Like, it's really hard right now. We all have to trust each other. We have to trust that everybody's like, you know, keeping distance. We have to trust that everybody's wearing a mask. In this case, we have to trust that Mary Beth is going to pick a good advisory committee and they're going to make the right decisions and keep us all informed. And so I know it's uncomfortable to trust people we don't know well, but we're going to have to step out of our lane and kind of go out there.
So the question is the advisor, David, so is this advisory then a working group for the metrics? Is that going to be, I assume, a separate thing that we need to, that the board will probably, that, you know, the boards will make of themselves separate than the school committee, and then those who we designate as for the advisory board will bring that information, as well as, you know, we could, you know, simply give you that information too. David.
I think we ought, I think it would be inappropriate to put Mary Beth on the spot during this meeting and ask her to name the advisory group. I think she ought to have the opportunity to think about this after the meeting and then decide and let people know. And I think likewise, she could decide that the advisory group, working group, call it what you will, also would come up with the final decision matrix or metrics matrix, whatever you want to call it. And then the composition of her advisory committee could draw on whoever they want to help finish it, to make it a finished product.
Great. David, if I could add to that a little bit, one of the things that I think would be really helpful in this moment is to get that metrics set up even before the formation of the group. We really, I think the community needs to feel that if we are, whatever modality we're operating in, the boards of health have looked at what the criteria is that it makes that a safe decision. And so that we're dealing with objective measures, right? Just given that there's so many different perspectives, what are the objective measures that we're going to rely on to make this decision? I will share that I've talked to a lot of people and done a lot of thinking about the composition of that team. A part of it is that it needs to be small enough, I think, to process things relatively quickly, and a number of voices need to be at the table. So what I'm hearing you say is the public health nurses need to be on that. Leah, I think, is the lead school nurse, needs to be on there. Tom Garrity, our director of facilities, who is very tied into our safety protocols and what we are doing in terms of facilities, needs to be on there. I need to be on there. A school committee member needs to be on there. And I think it's also very important to have a member of our teachers union on there, so that this is a very transparent process about what's being discussed and what is happening. So that is what I would recommend for the composition of that team. And I would also ask that if the Board of Health can come up with those metrics as soon as possible, I think that would really help a lot of the anxiety that we hear in our community about how would we know if it's safe to go back.
Mary Beth, I'll commit to having that done by the time of your school committee meeting on Friday. Okay.
That's wonderful, David. Thank you.
Mary Beth, I think that sounds like a great plan. And I hope that you know, again, my position is I trust you and I trust that you're certainly doing your best. It's just a part of sort of being on the Board of Health is just offering suggestions, offering things to think about. But that's ultimately what it is. But I think as a board, we can say we do trust what it is that you're doing.
Yeah, I mean, and first of all, this work is being done as a complete and total team. I cannot thank the members of our leadership team, our teachers who have been involved, our parents have been involved in offering lots of different perspectives to think about. And the Board of Health has been involved. So this is a team effort. And I'm greatly appreciative of this. And you know what I'll share is that we're talking about people's children, right? And when you talk about people's children, there's going to be emotion involved, there's going to be caution involved. And so we understand that completely. And I want to let you know that we take our responsibility to the children of Hamilton and Wenham and the families of Hamilton and Wenham incredibly seriously.
So David, if you're going to get these metrics, so how do you want the two boards to quickly get talk about it, get together and come up with that list so that the school committee can start to digest it and work on it? Do you want to get both boards to get, I mean, again, at this point, it's probably just picking a couple of people from the board, from each board to work as a working group very quickly. Now it's going to be a question of what's the people's capacity to do what's needed too.
Yeah. Well, I'll accept any volunteers that would like to work with me.
So I mean, again, I think I'm going to volunteer Mary Beth Ting just because she knows what's going on better than I do.
I appreciate that. Thank you.
And anything I learn at home, she pretty much knows it anyway. So it's just the same thing.
Okay.
Anyone else from the Wenham board or really, Mary Beth?
I'm just wondering where, Anthony, I don't know if you can help us, or Michelle might be able to help with this. If we have more than, you know, one member of each board, then you have a quorum and then there's open meeting. The logistics of how to work on something collaboratively as members of boards.
The fact that you guys are forming a subcommittee, you've already created a public body. So you've already done it.
We actually haven't created, Michelle, we haven't created a subcommittee. I've agreed to produce what Mary Beth requested, and
as soon as it's multi-member, you've created a public body.
Well, we don't have right now. I don't know anyone else from David's board who's in it, and then if Mary Beth, who's not a board member, is in it.
It's
Correct.
multi-members. So if Mary Beth is the second member, that's 2 members. Trust, I've been spending a lot of time with this open meeting law stuff, people. This is why this meeting is this way. Trust me, it's either one person or you just say, hey, David gets to make up the report and.
All right, let's stop here. I will produce a draft number 2. I will circulate it to both boards for comment, and that's not a group, and that's just me, right?
Yes.
Okay, that's the plan. And Mary Beth Ting, I want to circle back to a question you raised earlier. I think I have an answer for it. I have a list of questions from from at least one school committee member. Apparently you may have others. I think in the interest of, I don't know, just efficiency and time, it would be best if we attempted to respond in writing to those questions. Anybody agree or disagree?
I think it's fine. I haven't seen those questions. I don't know if I would be happy to provide input.
So if you're going to do that, I just want you to know we're going to publish those answers, because part of the reason we meet in public is to allow the public to know what kind of things have happened. So just when you respond, just know that you want to just double check your grammar and all that kind of stuff, because they're going to be published.
I think we would want to present it in such a format and either give it to the chair of the school committee or the superintendent as an FAQ document, that these are questions that have been asked, because even in the ones submitted, although the verbiage was different, there were several questions that the intent of the question was exactly the same. So we can just generate a list of FAQ, which most everyone is familiar with, and then that can be made not only accessible to the school committee who asked them, but to the parents who share similar questions as well.
I'm in strong agreement for that. I think that's what we need to do more of.
Yeah, and we're in the process of, developing a website, and it's where all this information can go so that people will be able to access it. So having a FAQ document from our medical experts will be, I think, very, very helpful.
Michelle, thank you for keeping us out of trouble.
We're sorry that we got ourselves in trouble. So thank you for still being willing to come. I really appreciate that you could come and just talk about that. I do think there are a lot of lingering questions, so we'll forward those on to you. So that would be great.
Okay.
And also, I think anybody else here who's watching should know well, I think the Wenham Board of Health gets paid like 30 or 40 bucks like a year. Like, it's not a lot. If you still get
actually get 0.
Oh, you're back to 0. So all of these people here are taking time out of their work lives where they get paid to do this, where they get not paid, and it's a significant workload right now that I really hope the public can appreciate, where we are doing the best that we can. And we will read and understand what you say, but we're doing the best that we can to make sure we make the right decisions.
Yep. Great, thank you. So David, you want to adjourn your board?
Sure. Do I hear a motion from one of the Hamilton board members to adjourn?
I make a motion to adjourn.
I second that motion.
Okay, motion's been made and seconded. All in favor? David Smith, aye.
Giselle Perez, aye.
Christopher Small, aye.
Okay. And so I'm Andrew
Dr. Ting,
Yep.
before you make a motion to adjourn, I might suggest to you respectfully that you might want to set your next meeting. And I can tell you that I know that Regina Baker is available Monday and Tuesday next week, but not Wednesday through Friday.
Okay. So we will let people know, and it will be posted, I guess, no later than Friday then, right? For a Monday, Tuesday meeting. Or Tuesday meeting.
Or Thursday, probably.
Thursday, is it 40?
Yes.
I always forget the number of days because you need business days, right? So
Yes.
we'll let.
So I was just suggesting that you maybe decide now so that I can get it posted tomorrow. You decide with Jerry on a meeting day and time.
Sure, I gotta look at my calendar quick. I'm sorry, I'm not looking at people now. I'm looking at a calendar.
And you're not sitting on a beach, right?
I am not. I'm sitting in my office, which I wish was a beach.
I know, and I'm not on the boulevard either. So.
Yeah. So Jerry, I could do 3, 4 o'clock on the afternoon on Tuesday. Can you
What?
do 3 o'clock next Tuesday, the 18th?
No problem. What can you do?
Yep.
What-
Can you- 4 o'clock, Andrew. DPH is 3 o'clock.
Okay, 4 o'clock. Catherine, you got, so you're gonna post that, Mary Beth? Okay, perfect.
I
So
will
now
post it.
everyone knows the next Wyndham Board of Health meeting is next Tuesday at 4 p.m. I'm Andrew Tang. I'm gonna put a motion to adjourn the Wyndham Board of Health. Do I have a second?
Second,
Jerry, all in favor, say aye.
aye.
Jerry says aye. Andrew Ting says aye. So we are done. Thank you for everyone for joining. I mean, there's a lot of people on here. I'm very thankful that you all joined us, and there will be more to come. And we will be working furiously to help David do what he needs to do. So, and we'll see you guys on Friday then, school committee.